Right, so Rumbi is joining, and Rumbi is our first speaker. She is a journalist based in Southern Africa. Are you now in Botswana?
Yes, I'm in Botswana.
Right. So Rumbi is also part of our newsroom, part of our team that works on the Radar project. And Rumbi has written for us some time ago. She's published her great interactive piece, Medical Hostages,
Yes.
about Zimbabwe. So, and Rumbi, I know that you are going to present today about, you're going to talk about the responses in Africa and lessons that you've learned from Ebola. And I think it's going to be really useful. In the morning, actually, there was a presentation about the lessons from the SARS outbreak from Taiwan. So I think it's going to be a nice combination now.
Okay. Yes, I'm going to be talking about the lessons that we learned from Africa, and if we actually did learn any lessons from there, if we've been able to apply that knowledge to this new pandemic.
Absolutely. Absolutely. Right. So shall we start then?
Okay, so I've got a little presentation for you guys, and I am just going to move straight into it.
Oh yeah, and that would be great.
Go through the slides. If you guys have got any questions, please feel free to ask. Okay. So I am sharing now. I hope you can all see my screen.
Yes.
Mm-hmm. Yes.
Okay. So just to give you a start, I'll be talking about lessons learned from the Ebola pandemic. And by the Ebola pandemic, I mean the 2014-2016 Ebola pandemic, and if we've learned any lessons from that. So to start off with, I'll just give you an overview of COVID-19 in Africa. This is a little map that shows the current cases that we have. This is actually from yesterday, so we may have a few changes. As you can see, it's mostly in Northern Africa right now. In Southern Africa, we have South Africa with the highest number of cases. I think South Africa and Egypt are standing at 4.8 cases, while Algeria is at 3.5 and Morocco is at 4.2, if I'm not mistaken. So those are the countries with the highest number of cases right now, which is still under 5,000 cases. In total, we have about 31,000, just under 32,000 actually cases. We've had 1,423 deaths and 9,566 recoveries, which isn't too bad if you look at those stats. So the first case that was reported in Africa was actually on the 13th of February. This was in Egypt. Countries with the highest number of cases right now, as I said before, that's Egypt, South Africa, Algeria, and Morocco. We still have some countries with no confirmed cases. That would be Comoros and Lesotho. But when we say no confirmed cases, that's a bit of an ask there because we're not actually sure if they don't have cases or there are questions about the testing capacity and things like that. So we'll just say no confirmed cases for now. So the WHO has actually warned that the continent is poised to potentially become the next COVID-19 epicenter. And with our relatively weak and underfunded health systems, this could be a huge concern for us. Mm-hmm. Just to put that in perspective, we have less than 5,000 beds in intensive care, and this is across 43 countries. And looking at 41 countries that submitted data, we have less than 2,000 functional ventilators. So as you can see, if the disease is to get a hold in Africa, it would be a real problem because we simply don't have the resources. And we see that countries that are well-funded, have got stronger health systems than ourselves are struggling. So in our case, we actually look at it and we think it's going to be disastrous. But there is one advantage that people have identified in Africa, and that's the 2014 to 2016 Ebola outbreak. It's strange that a pandemic could actually turn into an advantage for us. But then through this pandemic, we've actually learned quite a few lessons that can be applied within this setting now. So the history of the Ebola pandemic, we'll just go through that quickly as well. According to the CDC, the Ebola pandemic, there were 28,639 suspected, probable, and confirmed cases of Ebola, and 11,316 deaths of Ebola. This was like in the 2014 epidemic. In comparison, all other Ebola outbreaks have a total of 2,427 reported cases and 1,597 deaths. Workers were also greatly affected by Ebola, and they were the group that was highest at risk for contracting this disease. From the start of the outbreak, that was through November 2015, a total of 881 confirmed health worker infections were noted, and 513 deaths were reported. And this is only in 3 countries, Guinea, Liberia, and Sierra Leone. And the World Bank also estimates that 2.2 billion was in 2015 through the GDP of these 3 countries as well. So from this, there were some great lessons that were learned. And the director of the WHO in Africa, Matshidiso Moeti, has identified 5 key lessons that we can take and use during this pandemic. First of all, she says that it's important to start work early, especially at the community level, because communities are key at the start of an outbreak in terms of surveillance and recognizing patterns of illness. She also points out that it's important to listen to such people and to incorporate information into strategies that are used. We shouldn't just talk to people, but we should also listen and get feedback from them so that we are able to use this in our strategizing. Using the capacity already in place for Ebola outbreak will also be key. For example, so many labs were set up because of the Ebola experience, and using these to actually test for COVID-19 will also be key. And there's also she also placed a great importance on point of entry screening as well as partnerships. So those are the 5 key lessons that she says we should take away from the Ebola pandemic. So the question remains, has Africa actually learned from this? In short, we've experienced the virus for a short period of time. The first case was noted in February, but in short, I'll say that, the current responses that are taking place across the continent show that these lessons have been taken into account. Structures from the Ebola crisis are being used currently. If you look at an example in Liberia, the Liberia National Public Health Institute, which is key in fighting the COVID-19 pandemic right now, did not exist before Ebola. And Ebola now means many West African countries such as Senegal, Liberia, and Sierra Leone currently rank better prepared for COVID-19 than richer countries with more sophisticated health system. And because of Ebola, there are already far many countries that are capable of testing and diagnosing COVID-19 samples. In addition to that, the Ebola outbreak also proves that health systems and workers invariably also rely on getting locals to adopt simple but crucial behavioral changes, including consistent hand washing and ditching self-medication practices. If you take an example of using the community, like we'll look at Liberia, during the Ebola pandemic, the government are looking to get Muslims to stop handling infectious corpses in the process of burial rites, asked the country's imam to go on national radio to discuss the issue before significant change was noticed. When the government officials were actually asking this group to actually stop doing this, no one took notice. But when the country's head imam actually went on radio and said that we need to change what we're doing because of this pandemic, people started making these changes. So similar strategies are also now being noted during the corona pandemic. One of the responses that we've noticed that's up is in Somalia. They now have what they call an anti-corona army. These are religious leaders that are tasked with sharing information about the COVID-19 pandemic. And they're also working to work against harmful propaganda that's being shared by Al-Shabaab. So in this case, they've used Muslim leaders once again because they have the ear of the community. So they're taking that lesson into account. In addition to that, I think that Africa has acted quickly. For example, if we look at the South African government, which currently has the highest number of cases, they initiated a lockdown with only 1,000 cases and before a single death was reported. Point of entry testing. When we look at point of entry testing, countries such as Ethiopia, Benin, and Zimbabwe have all introduced travel bans and mandatory quarantine for returning residents. Partnerships have also been made with private sector, individuals, and NGOs, and responses are coming from all sectors. For me, I think this has been key, that responses are coming from all sectors. We're really seeing NGOs, development partners, the private sector, and individuals all working together to respond to this pandemic, which I think is probably one of the greatest things that has come out of this. So I just want to take you through a few notable responses that I've noted while looking for responses to add to our system. This is quite great. South African doctors have introduced something called the Into box. So this is an innovation that limits exposure to patients and medical personnel or when they're treating a patient. And this was created using a similar design that was adopted during the Ebola epidemic. In addition, the African Development Bank has started a hackathon, or a 3-day ideathon rather, where they are asking different people from all walks of life to come up with ideas for them to fight the virus. So it's people coming together online, 3 days, sharing ideas, and of which the best ideas will then Rwandan engineers from the Polytechnic have also completed their first ventilators. They've created their first ventilators. And in addition to this, I actually read a very interesting story today. In Senegal, some engineers have developed ventilators that will cost $60 to produce, and a testing kit that should cost $1 to produce. Those will be now ready for market in June, but you can imagine what a difference that will make creating a testing kit that only costs $1. In South Africa, this one was very heartwarming. Rival gangs in Cape Town have come together to distribute food during the country's lockdown. They noticed that people in their community are starving, and they just came together to start distributing food. In Burkina Faso, we have the army mass producing face masks. And my favorite is a Namibian boy, a 12-year-old Namibian boy, is teaching maths and English in his backyard during the lockdown, just to help other children remain focused on school during this time. Okay, are we still together?
Yeah. I mean, I'm listening. It's a great presentation, and it's really great to see. Well, I mean, your examples are really, really great, and these rival gangs coming together, that's kind of interesting. And yeah, I mean, those startups as well. I think you guys have a thriving community, tech community, and they are doing a lot to help as well. So I've been listening.
Just thought I should check in. Yeah, so for my next part of the presentation, I'm just going to zone in on Botswana, which is where I'm based. And I think, well, I'm hoping that after this whole pandemic, we will be a great case study in acting early. So for me, I feel the greatest thing that the government has done in Botswana was to act early. So I've created a little timeline of all that we've done during this pandemic. So on the 16th of March, with no confirmed cases in Botswana, Botswana imposed a travel ban for travelers from high-risk countries and a 14-day mandatory quarantine for any returning residents and citizens coming from this country. They also banned international travel for government officials and hosting of international conferences. Public gatherings of more than 100 people were also banned, and social distancing in public places such as banks, supermarkets were implemented. On the 21st of March, they closed down all bars. Liquor could only be sold for outside consumption only. On the 23rd of March, they closed all schools. And on the 24th of March, travelers coming from South Africa were also added to the list of people that needed to go into mandatory quarantine. And all this was done before it even reported any single case of COVID-19. And then on the 30th of March, that's when we reported our first 3 cases. The 31st of March, after we reported the first 3 cases, we got a 4th case, and this was someone who'd actually died. We only have 1 death so far, and this is someone who passed away on the 25th of March, but unfortunately, they only confirmed that it was COVID-19 on the 31st of March. So after this case, I think the government went into overdrive. On the 31st of March, they announced what we called at the time extreme social distancing. It was basically a lockdown. I think they thought the word lockdown would scare us. So they announced that we'll be starting a lockdown from the 2nd of April and a public state of emergency. And on the very same day, they established a COVID-19 relief fund, which the government invested 2 billion pula, that's our local currency. To get that in US dollars, you just divide by 10 as seed money. Other partners and private companies, individuals were all encouraged to donate into this, and people have really come together making donations into the fund. On the 2nd of April, we started our lockdown and public state of emergency. On the 9th of April, we now had 13 confirmed cases. They then extended the lockdown, the state of emergency rather, to 6 months. The lockdown was still at 28 days. So the state of emergency that they extended to 6 months means that we will not be having any entry from, we won't be having any foreigners coming into the country. People, returning residents and non-citizens can still come, but there's a travel ban on anyone else entering the country. In addition to that, there's no travel in between villages. Schools and religious places of worship have also been closed. On the 27th of April, which was last night, they extended our lockdown by 3 weeks. Not so pleasant, but we understand why it has to be done. And so far, we only have 22 confirmed cases. So I think that's a lot to do with only 22 confirmed cases. And some notable responses in Botswana. Like Africa, all responses are coming from all sectors of the community. For example, the Botswana Institute of Technology and Research, in collaboration with the COVID-19 Presidential Task Force, has developed an e-permit platform. So what an e-permit platform means is that we're basically not allowed to leave our houses during the lockdown. And if you are to leave your house to get groceries or visit the doctor, you need a permit to do that. So initially, we didn't have an e-permit platform, and we had to go to centralized places to apply for this. And you'd find that if I wanted to go to the grocery store, which is quite near to my house, I'd first have to go further and apply for a permit before I'm allowed to go to the grocery store. So they introduced an e-permit platform to cut down on that. We have an NGO called Sisonke, which is working with health officials to provide 3 months antiretroviral medication for sex workers. So these are people who are also under lockdown, and they're afraid that they might stop taking their medication. So they are working to make sure that their medication can be delivered at home. We have another foundation that's collecting baby clothes and essentials for pregnant women, because all clothing shops are closed right now. So they're basically collecting donations from everyone, delivering those to hospitals, so that if everyone does deliver a baby during this time and they don't have enough supplies, the supplies are already available at the hospital. We've got the Botswana University of Science and Technology that's in the process of disinfecting public places, and they're using sprayer drones to do that. And then we also have hotels in the country that have made rooms available free of charge to those that have to go into mandatory quarantine. So I think overall that the performance in terms of Africa has been good, but it would be amiss of me not to mention any concerns that we have. So currently, we have a low testing capacity. In Botswana, so far, I say we've got 22 confirmed cases, but we've only had like 6,000 odd tests done. So the worry is that we might have a low number of cases because we're not testing enough. In addition, we also have porous borders, especially in Southern Africa, where people coming in from Zimbabwe illegally. So these are people who won't be quarantined, who won't be subjected to tests. And so that's a concern, as that might also spread the virus. We've also had a number of cases reporting human rights abuses during lockdown. The police and the army have been sent out to ensure that people are adhering to the lockdown regulations. And we've had unfortunate cases where people there have been human rights abuses, people getting beaten up for being on the streets. And in some cases, just people being embarrassed, asked to do frog jumps and all kinds of things just because they were found wandering on the streets. And then we also have some communities which I would say have been neglected. Like in terms of the Botswana response, the response has been great, but we also have a great number of illegal immigrants in the country, and the response doesn't cater to them because they actually have to register with various platforms and whatnot in order to get supplies, to get food, or to get like a wage subsidy. So this won't actually cater for such people, illegal immigrants. And these are people who are basically informal traders, so they live from day to day. So as soon as you implement a lockdown, it means they don't have any income coming, and they should be the first people who start suffering. So I think such groups also need to be included. And then we also have untested cures. I'm not sure if you guys have heard about this, but the president of Madagascar has actually announced that the country has found a cure and a vaccine. This is in the form of an organic drink. It's not as bad infecting yourself with a disinfectant, but it's not tested in any shape or form. So the worry is when you tell people that you've got a vaccine and you've got a cure, they won't stop social distancing and everything else. And in addition to that, there's been a lot of misinformation. This is information shared on Facebook and other social media platforms. and other social media platforms during the pandemic. So there's been a lot of misinformation, and the worry is that people may take such things seriously. Yeah, so that's basically what I have for you guys.
Yeah, well, that was amazing. I mean, you've covered pretty much the whole continent actually for us. And thank you for your focus on Botswana. I think it's really interesting. I must admit, we don't hear much about that country. So how would you compare the responses and how the country's authorities, how the country itself reacted to the coronavirus, let's say, compared to other countries, neighboring countries in Africa, so that we kind of have an understanding of it?
So for us, we're not actually a small country in size, but we're a small country in population, and we don't actually talk about Botswana quite a lot. But I think the country has the resources, and they've been able to put those resources to use, and they've also been able to act quickly. So I would say, looking at the countries around us, especially the countries in Southern Africa, Botswana has been able to, one, act quickly and put resources to work. If you compare us with a country like Zimbabwe, which is one of our neighbors, they basically just do not have the resources to make the kind of changes that the government has been able to do.
Mm-hmm. And look, it's okay. I actually love it.
Could you hear that, the noise in the background?
Yeah, it's an amazing voice, actually.
No, we couldn't. No.
Okay.
Is it your child?
Yes, it is. And you know, my biggest fear when I was doing this presentation was that she's just going to run in. I don't know if you guys have seen that viral BBC thing where the child runs in. So that's been my biggest fear all day. And I've been telling her, I've got this work phone call. I need you to sit in here and be quiet. Sit in here and be quiet. And I think she gave me like 15 minutes, then she started.
Yeah, no, it's totally fine. May I just quickly ask you, like, the last question? So you're just
Hanya is like dragging you, like, yes, 5 more minutes.
Negotiate with your daughter, please, with your child. So I was wondering, you mentioned that that's like super exciting. That's super interesting. You mentioned that overall the continent has a good response, right? I remember that some time ago, Bill Gates, whose foundation works a lot in Africa, said that if the coronavirus is ignored, it's going to be devastating for the continent. But now it seems like we can be hopeful. We can have some hope, right? That apparently it's going to be, it might be okay. So am I right? Can we be hopeful, you think?
I think our only hope comes in containment. If we're able to contain the disease, then we have hope. However, if we start seeing the numbers, like the numbers that are happening in New York, in Europe, I don't think there's much hope. So our only hope comes in containment. Our only hope comes in acting early and acting now. And it looks like overall the continent is acting, and we're just hoping that we can keep those numbers down. So the test comes during this next period. So many countries implemented really strict lockdowns to begin with. And then in this next period, we're going to start opening up our economy. So the test comes there.
Right. Look, we actually got a response from the audience, from a question from the audience. What are the institutional or rule of law risks that you see as a consequence of the measures taken from the government in Africa?
Okay, so with that, there's been a lot of talk about that. Like if we take Botswana, for example, we're on a 6-month state of emergency, and we had this massive debate of whether it's necessary for us to go into a state of emergency for 6 months. And it was basically that people were saying that this is just basically going to lead to an abuse of power and whatnot. And we've seen like a few instances where there have been questionable things that are happening. Like in our country, for example, we've had 2 people who are leading the COVID-19 fight, or the leaders in the health ministry that were just fired. We haven't been given any reasons as to why this is. So there's always that concern about abuse of power. And then also in implementing lockdowns, when we say that we are sending the army out or the government out or the police out to ensure that these lockdowns are properly implemented, it's very different when you're in Europe or when you're in Africa. In Africa, people tend to fear such forces, and such forces have abused power on so many numerous occasions. So there's always that fear that there's going to be an abuse of power. And we've already seen some human rights violations in places like South Africa and places like Zimbabwe, where you meet up with someone on the road, an army official or police official, they ask you where you're going, it's a lockdown, and next thing you hear that someone was beaten up to an inch of their life. So there's always such concerns, but I think that's where civil society falls in, or the NGOs fall in, where they have to monitor this state of emergencies, because we do need the lockdowns, we do need the state of emergency, but we need to monitor them closely. That's where the media also comes in.
Right. Well, thank you so much. Thank you so much for this, and it's been really, really interesting. Right, so stay safe and healthy wherever you are, and take care of your child. Thanks for joining.
And enjoy the next bit. Bye-bye.
Thank you. Thanks. Bye-bye. Bye.